We've arrived at part 10 of the blood vessels, and since we have negotiated properly the movement of blood out of the thoracic cavity on the right side, not the left side, but the right side has the special artery called the brachiocephalic artery. Okay, so it is it's a unique asymmetrical feature here that then gives way to the common carotid. Here's the common carotid, and we also have the subclavian artery. So that's part of that program right there. We're going to go now and take a look at the blood flow to the outside of the head. And we're going to be proceeding along this common carotid artery. It's going to divide. Part of it's going to go into the skull through the carotid canal, and that portion will be called internal carotid artery. And then part of it will be staying on the outside here and contribute to a number of branches on the outside, and that's called the external carotid. Okay, and the external carotid has altogether 6 branches, which I've named here or numbered here for you from the beginning to the end. Okay, so as we come up, you'll notice that we have a branch right here heading downward. It's called the superior thyroid artery. So it's coming from above the thyroid gland and going down and supplying the thyroid. Another artery next here, number 2, is called the lingual artery. And what it's doing is it's going behind the mandible here up into the oral cavity and supplying blood to the tongue, hence the lingual artery. The next one is also going to go behind the jaw, and then it's going to suddenly sort of wind down behind the jaw and then come up through a groove right here. This is the facial artery, number 3. And if you were to palpate right there, place your finger right on your jaw, right there, put a finger on your jaw, feel for the groove in your jaw carefully, sort of push from the bottom up, and you will get a pulse there. It's a pulse point. And you'll see that arteries here are going through their tortuous route, something I didn't mention to you yet, but I will. I will compare arteries and veins in a different way, which is that veins tend to go straight and smoothly from one place to another, whereas arteries tend to go through these little sine wave tortuous movements. And at the peak of each sine wave, occasionally they'll be giving off a branch. Okay, so at any rate, we flow all the way up to the top of the nose here on the facial. This is also the beginning of blood flow through the central portion of the head, so all of the venous structures in this part of the anatomy, the nasal septum and so on, actually flow through the skull. We'll have a moment to discuss that. So that was the facial, and then number 4 here is going to go the other way, backwards. It's going to go to the occipital region. The occipital artery is over, let's follow the arrow here to this over here. It's actually sort of winding down and up, and so it's taking care of the back of the head, the scalp, in that direction. And then once we get past that particular division right there, that branch, we're going to come up and we're going to go through the final bifurcation, as it were. So we're going to bifurcate here into the maxillary, and the superior temporal, 5 and 6. So the maxillary and the superficial temporal going up this way. Sometimes if you see somebody working particularly hard at the very edge of their capability, you'll be seeing a pulse in their temple up there. Somebody trying to lift something extraordinarily heavy in there at the very edge of their abilities. Okay, the only way to actually see where the maxillary is going is to look behind. It's actually, do you see that it's traveling behind the mandible here, and then it's emerging and continuing to travel out over this way through the middle of the head. And there is a branch right here. At the beginning of the course, I asked each of you to learn all of the things that are living in the openings of the foramina of the skull, and I asked you for the foramen spinosum contents and life and that turned out to be the middle meningeal artery, okay, which supplies the meninges on the outside of the brain. It's the one often that gets interrupted if there's a fracture. Somebody falls off their bike, they hit the curb, and they're not wearing their helmet. Then there's a fracture, and the artery actually is having its blood flowing into the skull, causing the potential for a stroke. A very dangerous situation. So we have our maxillary coming this way, and we have our superficial temporal. Okay, so that concludes that little observation. We have another interesting artery that's coming up this way, and it's actually a branch of the subclavian, and it's traveling up through each of the transverse foramina of the cervical vertebra. We learned about that when we were studying cervical vertebra, that they have the transverse openings there, the foramina, and this is what's living there. What's living there is a vertebral artery. Okay, the vertebral artery is named right here, vertebral artery at the very top, where the right comes together with the left, and together they flow through the foramen magnum and form the basilar artery, which leads to the circle of Willis, which is what we're going to look at next right here. This is the circle of Willis, called the circle of Willis. These days, eponyms are being looked down upon at the undergraduate level, but when you get on into the clinical sciences, it becomes a prevalent term. All of the eponyms become prevalent in clinical science. Okay, so this is a circle of anastomosing arteries, which simply means that the blood flows all together here. Here are the internal carotid arteries after they've emerged from the carotid canal. So basically we've transected right there just to see what's going on. The internal carotid, let's take a look here, internal carotid is going to divide into the middle cerebral and the anterior cerebral, which goes up this way. Here's the anterior on this side. Okay, anterior cerebral. Notice that the two anterior cerebrals are going in between the hemispheres right there, and that we have a crossover, a linking little artery here between the two anteriors called the anterior communicating, where here the anterior communicating, okay, is that one that's between the two anteriors. So then coming down this way, we have something called the posterior communicating, and that goes from the middle, as you can see here, middle cerebral artery. It goes down to the posterior cerebral. Posterior communicating going to the posterior cerebral down here. Another way to get to the posterior cerebral is to come up through these vertebral arteries, which then come together and they form this artery over here that's going to go over the pons. And this artery is referred to as the basilar. The basilar then comes up here, and it divides or bifurcates into the posterior cerebral artery. Okay, and then the posterior can communicate with the middle cerebral artery. Okay, and that concludes this brief little section here on blood flow in and out of the head.